Hey guys, my name's Sam and welcome to Prep Medic. In this week's video, I'm going to be going over abdominal trauma. So we're going to cover anatomy, we're going to cover assessments, and we're also going to talk about how to treat abdominal injuries once you find one. So before we can discuss actual abdominal injury, we have to talk a little bit about anatomy. Now your abdomen is right below your diaphragm, and that's the dividing line between the thorax. Now your diaphragm is a large muscle that contracts that allows you to inspire air. All right, so your abdomen is actually divided into 4 distinct quadrants. You have your right upper quadrant, your left upper quadrant, your right lower quadrant, and your left lower quadrant. In your right upper quadrant, you primarily have your liver and your gallbladder. In the left upper quadrant, you have your stomach, spleen, large intestine, and small intestine. In your left lower quadrant, you have small intestine and large intestine. And in your right lower quadrant, you have your large intestine, small intestine, and your appendix. In addition to the major organs I just discussed, you actually have 2 big sets of vasculature running down the center of your abdomen farther to the back. And those are your descending aorta and your inferior vena cava. Now your inferior vena cava is a large vein that brings a lot of blood back to the heart, and your descending aorta is a large artery that brings blood away from the heart, if you didn't already know that. You also have your bladder, which is at the center of your abdomen, and then you have your kidneys, which are on either side closer to your back and farther up towards your rib cage. Most of the organs in your abdominal cavity are surrounded by the peritoneum, which is a protective case that goes around them. There are some organs that are actually retroperitoneal that sit outside this case. There is, of course, a lot more to abdominal cavity anatomy. However, for this video and what we're talking about today, that's the basis of what you have to know to understand abdominal trauma and treat it effectively in the field. Now I want to move on more towards the types of trauma and what the different organs do if they're injured. Now, generally speaking, solid organs are going to bleed and hemorrhage, and the person will go into hypovolemic shock after a time. A hollow organ, however, will usually rupture and spill its contents into the abdominal cavity, causing sepsis and peritonitis. So you have 2 main types of trauma. You have blunt force trauma, which is a compressive force being exerted on the abdomen, and this can cause both ruptures of the hollow organs or bleeding in the solid organs. And then you have penetrating trauma, which there are a couple different categories of penetrating trauma. The first is your standard penetrating trauma, which is a knife wound, a gunshot, something like that, where you have intrusion into the abdominal cavity. You then have an impaled object, which is an object sticking out of the abdomen, and then you have eviscerations where the organ is actually protruding from the abdomen. Each of these is treated a little bit different, and we'll discuss that later on in this video. Before we can talk about treating these types of injuries, we have to talk about abdominal assessment. This is important so you don't accidentally miss an injury that has occurred and you understand what you're looking for. The first sign of abdominal injury is going to be evaluating your patient for signs of shock. So these can be elevated heart rate, low blood pressure, cool pale diaphoretic skin, or an altered mental status. These are all signs of hypovolemic shock. The second thing you want to look at is the mechanism of injury of the patient. If the patient was in a motor vehicle crash, you should look at how fast the car was going and if any safety devices were used by the patient, such as a seatbelt. If it's a gunshot wound, you want to determine the caliber of the gun and how many times they were shot. If it's a stab wound with a knife, you want to take a look at how long the knife is, and if you can see gore or anything on the knife, that might give you a clue on how deep it was inserted into the abdomen. To assess the abdomen itself, you're going to start with inspection, and that's just visualizing the abdomen. The first thing you're going to look at is to see if there's any obvious distension or areas of the abdomen that are protruding where they should not. You're going to look for any outward signs of trauma, so any impaled objects, penetrating wounds, major bleeding, anything like that, up to and including eviscerations. You can actually look for Cullen sign, which is bruising around the umbilicus, and that's the sign of a retroperitoneal bleed. Or you can actually look at Gray-Turner sign, which is bruising on the flanks, which is the same thing. If you don't see anything obvious indicating abdominal trauma, you can move on to palpation. You should always palpate from the point where it does not hurt and work your way to the point of maximum pain for the patient. You want to be gentle with this, and you do not want to press too hard if they are obviously injured. If the patient has penetrating trauma or an evisceration, avoid palpating the abdomen at all. When you're palpating, you're feeling for any rigid areas of distension or especially guarding by the patient. If they tense their abdominal muscles before you push down or they're in obvious pain, that's a sign that something's going on deeper in the abdomen that we need to be clued into so we can get them to a trauma center right away. Now, before we get into the treatment section of this, I want to make it very clear that abdominal injuries are not fixed in the pre-hospital setting. Most of what we can do that's good for the patient is get them to a trauma center right away, get them under a surgeon's knife, because ultimately nothing we're going to do in the field is going to make much of a difference besides identifying that as a serious injury. The treatment for blunt force trauma is pretty simple. You want to treat for shock, keep them warm, put them in the position of comfort, and get them to the hospital as fast as possible. For penetrating trauma, you just want to take a bulky dressing, lay it on top of the abdomen to prevent anything from getting into the wounds and preventing further infection, and once again, getting them as fast as you can to the nearest trauma center. Eviscerations are treated a little bit differently. If you notice somebody's organs are protruding from their abdominal cavity, you want to take a bulky dressing and wet it with some kind of sterile saline or sterile water. Place that dressing over the eviscerated section, being careful not to press the organs back into the abdominal cavity. This moist dressing will ensure that that organ is not drying out and beginning to experience necrosis. On top of the moist dressing, you should put another dry dressing, and that's going to prevent further heat loss. You want to make sure that any patient exhibiting an abdominal injury is kept warm, as hypothermia actually kills in trauma, and these patients are prone to losing a lot of body heat. The last type of injury we're going to discuss today is an impaled object. With an impaled object, you never want to remove it, and your ultimate goal is to stabilize it in place while controlling bleeding around it. So if you have, say, a knife sticking out of the abdomen, you can take gauze rolls and put it around the knife to prevent that bleeding around that site, and then you want to stabilize the knife in place so it's not moving around making mincemeat of their internal organs. Once again, you do not want to remove these in the pre-hospital setting because they need imaging and a surgeon to remove it safely. I want to quickly discuss bleeding control in the abdomen. This is not something that can be accomplished in the pre-hospital setting, unfortunately. We cannot pack an abdominal wound because there's a lot of space in your abdomen and you do not have enough gauze to provide pressure on whatever artery is bleeding. Furthermore, you're going to be causing a lot of internal damage and leaving them open for a greater possibility of infection. I know this video is pretty rapid fire, so if you have any questions, please leave them in the comments down below. Keep in mind I have videos out on thoracic trauma as well as bleeding control in the arms, some airway maneuvers, and splinting. So if you have more questions about first aid, go check those out. I have got a playlist on my homepage that you can find those at. Otherwise, I will see you next week where we're going to be going over my car kit.